Caregiver means someone that is supportive and there along the way through a family member or friend's journey throughout a hard time in their life.
Welcome to Healthy Communities. Today, we're looking at the mental, physical, and financial toll of caregiving. We recently spoke with 3 women who shared their unique stories of balancing work, life, and caregiving duties. The fact that we're talking to 3 women today is no fluke. Most primary caregivers are in fact women. And the impact of caregiving is often borne by people in historically marginalized communities. Khadija is early in her career at CVS Health and a full-time grad student. Her mother recently got sick with a bacterial infection and flew back to the US from Nigeria to receive medical treatment. Kadija had to manage the household and look after 2 younger sisters during this time. That period of almost 3 months left an imprint on her.
My sisters and I usually have a routine where we know how to run the house, but when our mom came and she was sick, we honestly didn't know what to do in those situations because my mom's a nurse, so she's used to doing the caring. After witnessing this whole moment with my mom, I think I can pretty much handle myself through stressful situations and scenarios. I really like how I was able to be strong during that moment, navigating school, work, a household of my sisters, a high schooler and a middle schooler, which is a lot. I'd say I'm proud of the person I've become. There are going to be times where you feel like there's no one there to help you. You just want to lie down in bed and cry all the time. But I'm like proof that you can do anything you want, whether you have like a billion things going on in your life. Always believe in yourself and be strong.
Caregiving has been associated with more depression, anxiety, even an increased risk of early death. Teresa, an Aetna employee of 45 years, works from home. Her husband of 32 years, Robert, was diagnosed with ALS in March of 2020. Teresa now raises funds for ALS research through annual walks on Team Torres.
I know there are some days he's frustrated, obviously, coming from a very active lifestyle, a very strong man, and now basically, in bed a lot, in a chair a lot, in a walker. I never had to take out the heavy trash. I never had to change light bulbs. I never had to worry about the pool. Those are things that I do now. Financially, we have to be careful. Robert's not working, he gets Social Security disability. We pay attention, we don't go on vacation. I don't have anybody coming in yet, and I say not yet because there's gonna be a day when I'm gonna have to. Folks that I work closely with, I have told them, so they understand when I say I'm gonna be a couple of minutes late. I'm happy to be able to take care of Robert. That's my goal, to keep him home, keep him safe.
Finding professional help can be hard. A majority of people say there simply aren't enough people to meet the need today, and that gap is widening. Nina is a nurse educator with Omnicare who looks after multiple generations of family. Her father, who has severe COPD, lives in a home she shares with her husband and their dog Chicky. Nina's mother lives 6 houses down the block, and an uncle lives 10 minutes away in assisted living.
I can get to a point where I have an appointment for my uncle and an appointment the same afternoon for my dad, or my mom is calling, she has something urgent that she needs done at home, and everything will start to pile up together. I'm very fortunate that I have a very supportive family. My husband, he has been a saint when it comes to my dad, so my dad adores him. My dad won't eat dinner without my husband. Even if I'm starving, it's like, well, okay, I guess I'll eat by myself.
Gotta wait for Robert.
Gotta wait for Robert. So I think for every sacrifice, there is a beautiful benefit. I get to hear stories that I've never heard, and I get to spend time with him and get to know him on a different level. I've been a caregiver educator for years, but it wasn't until I actually stepped into the role that I realized, wow, how do people do it if they don't have that kind of knowledge? It makes me think about how important it is to involve other resources, like a pharmacist. When the pharmacist came and said, this medication should be taken an hour before all the rest of the medications. Well, I wouldn't have known that, but it's important.
What other lessons have you learned from this time being a caregiver?
Recognize that perfection is the enemy of your own sanity. That's the best advice I can give.
Yeah.
Learning to let go of aspects of control that you really think you have, you really don't have. It's not all or nothing when it comes to taking care of yourself. I've always felt that I have to have an hour, 2 hours, 3 hours a weekend. I've come to understand, because of the resources that I've had through CVS, that micro steps are so important, and it's been incredibly helpful to me. We surround ourselves with people that we love, that love us, that want to be with us and help us, right? Just the idea that somebody is willing to step in and help any way possible, it helps. I may not always ask, but it helps to know that there's people there around that are willing to help.
My 3 takeaways for caregivers are always make time for self-care. And if someone offers help, take it. And while it's difficult to be a caregiver, it can create the space for a new bond between you and the person you care for.